the same building. Both of them reportedly were in contact with mail. There are no postal workers involved in Florida. And currently the EPA is trying to decontaminate that particular site. There's a little over 1,000 people that are being prophylaxed with antibiotics for this. And to date, I believe that this is our only threat. There hasn't been anything new. How do we manage this? There's 3 ways that we can manage this. First off, prompt identification. Secondly, by managing exposures. And thirdly, by antimicrobial treatment. I believe that if we continue to put our public safety first, that we'll be successful in managing this situation. Now I figured I'd like to paraphrase a couple of questions that my patients have brought to my attention, some of the more common asked questions in the office. And hopefully in my answers you'll find solace and as being informed is our best way to cope with this. Our fears and anxiety. First question is, Doc, what should I know about anthrax? Well, what I tell my patients is that Bacillus anthracis, which is the cause of anthrax, is a large bacteria in a rod shape. It comes from the words bacillus and anthracis, bacillus meaning rod, and anthracis coming from the Greek term meaning coal, which is usually black, which describes the skin lesions that can occur. It usually has 3 major clinical forms in humans. The first one is cutaneous, which is skin form, which people get exposed through breaks in their skin by touching infected pieces of mail or wherever these spores that come from cattle might be from. The second one is inhalational or inhaled, where people would breathe this in. And the third one is gastrointestinal or ingested, where we would actually ingest undercooked meats from the particular cattle and deer that may carry these agents. Another question I get is, what are the signs of anthrax? Well, what I tell them is it depends on how you contract it, of course. First off, the cutaneous anthrax, the skin form, of course, presents with usually through a break in the skin. It's the most common form. Greater than 95% of all of anthrax is the skin form. It comes from contaminated meat, wool hides, and leather from infected animals. The skin forms a small little red spot that develops into what they call a vesicle, which has a little fluid. And then little by little that vesicle breaks down and the center area becomes black and necrotic. It may be painful, it may be painless. It may be accompanied by fever, it may not. It resembles, if anybody's seen a bite of a brown recluse spider. That's kind of what it resembles. And it's pretty treatable with early antibiotics. The second form, the inhalation or the inhaled form, is the most lethal one. You usually need a significant amount of spores. They believe greater than 5,000 spores to actually become ill from this. Again, there's an incubation time. Usually they say between 1 to 7 days. And unfortunately it resembles a viral illness when it begins, with sore throat, mild fever, muscle aches,